So I will begin with washing my hands first, and then I would knock on the door before entering. Hi, my name is Lulu. I'm a student nurse at Gurnick Academy, and this is my instructor, Laura. Is it all right if she's here with us so she can observe my patient care with you? She says yes. Can I go ahead and look at your ID band? Could you state your name and date of birth for me, please? Okay. Is it okay if I call you Margaret? She says yes. Thank you, Margaret. So at this time, I would provide privacy with the curtain. I already washed my hands and I could wear clean gloves if I want to. And then, Margaret, so I would like to perform a head to toe assessment. And what that is that I would assess the top of your head all the way down to your toes, with the front and back of your body. Is that all right if I do that today? Margaret says yes. Okay, thank you. So before we begin, I would like to know your pain level on a scale of 0 to 10. 0 meaning no pain at all, and 10 meaning the worst pain you've ever experienced. She says 0. Okay, that's good. Do you know who the President of the United States is? She says Donald Trump. Do you know what day it is today? She says March 25th. And do you know where you're at? She says Gurnick Hospital. So patient is alert and oriented ×4. And the patient has no lines or tubes. And I have all of my supplies ready and I have adequate lighting. So now I would have my my vital signs ready. So I would know Margaret's baseline before starting the assessment. And I would raise the bed to a comfortable working level. So it'll probably be like at my waist. So now I'll start with the face, the head and the face. So I would check if they are proportioned and if they're symmetrical. And then I would check if her hair is clean. I would look for any abrasions or lumps or sores. And I would use this time to check behind her ears for any skin breakdown. I'd check inside of her ears for drainage. There you go. For any drainage, and then I would go ahead and push against her tragus and ask her if she feels any pain or discomfort there. And then I would check for her hearing. So I would say a statement. I would whisper a statement to her, and then I would ask her to repeat back what I said to me. Okay, so now for the eyes. Margaret, could you go ahead and close your eyes for me? And open. I'm gonna go ahead and shine the light in your eyes. Just go ahead and look straight forward for me, okay? Okay, so both pupils are reactive to light and they are both round and equal. So now, Margaret, could you go ahead and follow my pen light? Okay, good. So now I would check her nose for any drainage or a deviated septum. And then Margaret, could you go ahead and open your mouth, please? Okay, so here I would be looking for any abnormalities or any sores. Margaret, could you open wide with your tongue out, please? And then here I would be checking the back of the throat for any swelling or redness. And then now for the neck. I'm gonna go ahead and feel your neck. Let me know if you feel any pain or discomfort. Could you go ahead and turn your neck to the left, please? And to the right. And then could you lift your head off the pillow? She can, she's able to do that. And then now for her shoulders. Let me know if you feel any pain or discomfort, okay? No pain? Okay, that's good. Are you able to lift your arms up for me? Yes, she can. She's able to do it. And now for your hands. Are you able to move your fingers? She's able to move them. And then here I would look at her nails and check for capillary refill. It shouldn't take more than 3 seconds. Now I'll be testing her strength, so I'm gonna go ahead. You can push against my hands. Make sure, I'm gonna push against you and don't let me push against you, okay? Good. Now then turn your hands over and I'll go ahead and pull. Don't let me pull you away from the bed. Okay, good. So here I'm checking for equal strength. And then now I'm gonna be assessing the heart. So I'm getting my stethoscope. So I'm gonna look for the aortic, which is on the right side, my right. So I'll be using the bell for this. The right side right here. And then pulmonary valve, tricuspid, and then for the mitral, I'll be using the diaphragm for that. And I would be listening for apical pulse for 1 full minute. Go ahead, I have a clock over there. So I'm gonna be using that starting now. Okay. So pulse was 86 beats per minute, so that's good. And then now I'll be looking at Margaret's chest and see how it rises. Her respirations are normal. And then now I'll be listening to her lungs using the diaphragm. So look over here. And then she'll be taking breaths in while I do this. Okay, thank you. And then what I'm looking for there are any like crackles or any wheezing. And then I'll ask her to sit up. So I'm gonna go listen to her back and do the same thing, but just on her back. She could sit up, but she'll be laying down like this. So again, I'm gonna be listening for any wheezing or crackles. And take a deep breath in. I'll make sure that I'm not going over the scapula because I won't be able to hear through the bone. Okay, good. So no abnormalities there. Now I'm going to assess Margaret's abdomen. First, I'm gonna be looking for any distension, and I would look at her skin color. Then I would listen for her bowel sounds, and then I'm gonna also feel her abdomen for any pain or discomfort. So look, it's all good. Now then I'm gonna listen from the right lower quadrant. Yes, right lower. So starting from here, and then right upper, and then left upper, and then left lower. And then I could be listening for at least maybe 2 minutes. So I hear no abnormalities and I don't see any abnormalities. And then I'll be feeling for any pain or discomfort if Margaret has any, and she doesn't. So I see none. And then I would ask her if she has experienced any nausea or vomiting. She would say no, she's been okay. And then have you had any bowel movement issues? Like, have you had difficulty needing to go to the restroom? She's says no, it's okay. And then I would ask her for the consistency of her stool and the color and the size. And then I would ask her if she's had difficulty going to go pee, if she's had any pain when urinating, or if she's had any odor or blood in her urine, as well as the color of her urine. And then I would ask if she's had difficulty eating and when was the last time she had her last meal. Oh, as well as her last bowel movement too, that's important to know. And then the stream of her urine too. So now I'll be looking at her legs. I'm gonna be looking for any swelling and the color too. So here I would lift up her legs and see if they're in condition. They're good. I can lift them up without forcing. And then I would feel her popliteal pulse. I would have to feel one at a time, not both. So good. And then now I'm going to be looking at her posterior tibialis, and that is near the ankle bone. So I'd be feeling that. And then, yeah, looking for any swelling. And then now I'm going to take off her socks. And I'll be looking at her feet for the same thing, any swelling. I would check the bottom of her feet as well, and then check her nails. And then do capillary refill there too. And then I will push her feet, and I would ask her if she feels any pain there. Any pain in her calves when I push her feet. So now I'm gonna check the posterior side, her back, so she could turn over. And then here I would be looking for her skin color and any pressure ulcers or any swelling or breakdown of the skin. And then here I would be wearing my gloves. I would spread her butt cheeks and look for any redness here too. And then since she's a female, what I'm gonna be looking for in the genital area is discharge or any odor, because that could indicate any infection. And then I check the back of her legs again for swelling. And I believe that is it. And if I didn't mention for her hands, like her fingers, I think I forgot to mention to check her nails. I'm not sure if I did, but now I'm bringing that up. So I believe that is all for head to toe assessment. So now after performing that, I would put the bed back to its lowest position, and then the side rails are back up, and then her call lights within reach, as well as her bedside table. I would make sure she's comfortable and ask her if she's comfortable so she has no pain. And then I would check for her body alignment, make sure alignment's good. And then now I would wash my hands here and document my findings.